Hi, I'm Dr. Ajaram. I will tell about throat infections, or in medical term we call as acute pharyngitis. So acute pharyngitis or throat infections is mostly affecting to adult and children, and it most of the times is acute only, and are caused by around 90% by viral infections. And this acute pharyngitis is a very common infection which is seen in primary care by physicians. And now I'll tell what the cause for this, what the reason. So approximately 80 to 90% is viral infections. So viral infections, virus like adenovirus, coronavirus, or influenza virus, and some bacterial infections around 10 to 20%. So N gonorrhea bacteria or streptococcus bacteria, and some disease like if someone is suffering with lungs infections or COPD or pneumonia or asthma, so they might suffer this also. And some risk factor I'll tell, like environmental factor like smoke, dust, or climate change, especially in winter or spring weather, spring season. And if someone is taking cold padarth or cold items like ice cream or cold drinks, so they get immediate effect. These are the few environmental factor and risk factor which is causing viral infections, throat infections. For the symptoms here, so this is acute, so sudden onset of a fever with chills, nose block, running nose, cold and cough, throat pain, throat irritations, headache, especially frontal headache, and body pain and light tiredness. So, what the treatment here? As you know, this is acute only, and most times viral infections. So, symptomatic treatment is recommended. So, short course of antibiotics like 5 to 7 days, and other symptomatic treatment. If fever, then antibiotic. If cold, then anti-cold medicines. If cough, then depend on the cough syrup like wet or dry cough. And for nasal congestions or nose block, nasal saline morning evening. And some other precautionary measure like how you can reduce, which help to reduce your viral infections. So hot water gargling and rest for 2 to 3 days. If someone is suffering, either adult or children, they should take rest in home, and use kerchief or a cloth while sneezing or coughing, or to avoid others not to get affected by viral infections. And taking some hot things like kashaya or hot water. And one more thing, maintaining hygiene like a repeated hand wash, and taking steam with amritanjan or Vicks gives immediate or soon effect. And one more thing I will tell, this is a winter weather in Bangalore or everywhere in India. So nowadays cold or viral infection is very common. Especially I will advise to children who are suffering with viral fever, they should stay in home. If they will go to school or they will go to a playing area, from one children to other children it may spread. So take rest, and please share this video. Thank you.